Let's talk about our next speaker. So he is basically Mr. Mahesh Jayaraman, and he's the co-founder of Sepalika, a women's hormone health clinic that has treated close to 1,000 patients till date across a variety of conditions like PCOD, irregular and painful menstruation, cystic acne, infertility, obesity, and menopausal symptoms. The flagship Sepalika fertility program helps couple conceive naturally, including after several IUI and IVF failures. Mr. Mahesh is an IAFFH certified functional hormone specialist. He is an acupuncture practitioner as well, registered with the Maharashtra Council of Acupuncture. He's also done his nutritional blood analysis, chemistry analysis from the US, and also functional nutritionist program from the Washington State University. His topic for today is a very interesting one and is a question in itself that comes in the heads of every couple today in India or globally. Do you really need IVF? Over to you, Mr. Mahesh. Please enlighten us on your views on the same. Yeah.
Thank you. Thank you so much, Dr. Karishma. Hello, everybody. Thank you so much for being here. Let me begin my presentation so that I don't waste any time. All right, so let's get started. So the question that we are asking today is, do you, and that's why we have underlined you, really need IVF? So first up and up top, let me make it clear that this is not about allopathy bashing. There is a rule. There is a need for IVF. It is a very, very valuable and amazing procedure. But the question is there anything that you can do? What is the proper way to approach IVF? And how should you be thinking about it? So that's the reason why we're asking the question, do you really need IVF? What can IVF do for you? What can't it do for you? And when should you really be looking at it after building all your foundations? So quick context, what is the experience that we are sharing? Well, Sepalika Fertility and Hormone Clinic, over the last 2.5, 3 years, we have had 33 pregnancies, out of which we have had 25 live babies, healthy ones delivered. There are 8 ongoing pregnancies as we speak. Today, we are kind of focusing on 10 of these cases, which are all IVF failed cases, multiple failures of IVF. Usually, 9 of these went on to conceive naturally after they worked with us in terms of our functional medicine approach to infertility. This is the context. All right, okay. So let's understand, why is it that couples, seek ART? This is for the benefit of course, all the, non-doctors and non-medical people who are attending. Well, so the general rule is that if a couple has been trying to conceive for at least 12 months when the woman is under 35, or for 6 months if she is over 35, and we've had, a failure for the woman to fall pregnant despite unprotected sexual intercourse, then we call it as an infertility case. That's the first diagnosis. What are the options that are used? Well, round one is you go ahead with, if there is a case of PCOS, metformin, which is an insulin sensitizer, is used. Clomiphene, letrozole, these are all things that help with ovulation. These medications, some of you who are already in fertility, looking for this, may already be familiar with this. Sometimes, gonadotropins are also used. When it comes to the surgery options, if the fallopian tubes are blocked, in some cases, there could be fallopian tube unblocking that is possible. Hysteroscopy, laparoscopy, removal of fibroids, these are all techniques that are used in conventional gynecology. Ovarian drilling is suggested for women with PCOD who have ovulation issues. And in a man, if it's a very serious varicocele, which is an enlargement of the vein in the testes, usually grade 4 or so, then there will be a surgery that is recommended. And of course, there is assisted conception, IUI and IVF. Those are your options that come in when you go to a conventional doctor, and it's in this order of priority. Quick diagram to just show you the difference between the two. Again, more for the patients and the various attendees, not so much for the doctors, but here you have it in IUI. You've got sperm that is only put in with some amount of medicines that are used to improve ovulation. Whereas when it comes to in vitro fertilization, after improving the amount of eggs that are produced by a woman in any given cycle, those eggs are extracted. They are then, the sperm is then inserted. I mean, there's insemination that happens in the lab. The embryo, which is the resultant of this fertilization, is cultured up to 3 days or 5 days. And finally, that is put in, right? So, those are the technical steps that happen. The reason that we are even showing this is, why is it that so many people are nowadays being in a hurry to get into IVF? Well, the procedure, the technical procedures in these two, this is what happens in the two. But here's what, makes a difference between the two. IUI is cheaper. Fewer drugs are used, obviously, which are of more, they are oral drugs that are usually used. They do have fewer side effects. But remember, and I've put it in red because this is a crucial difference. And many people come to us at Sepalika Fertility without actually looking at this particular factor. For IUI, your fallopian tubes have to be open. So there is a test called a dye test or a hysterosalpingography, HSG, that is done. You must have that open if you're going to try IUI. Again, I'll just quickly show you the diagram so that it's all clear for all of the common people. These tubes on the two sides are the fallopian tubes. And as you can see, if you're just going to insert, pre-washed sperm into the vaginal passage, the sperm still has to swim through this uterus. And once the egg is released from this, which is the ovary, the egg and the sperm have to meet within this fallopian tube. This is how nature makes it possible for natural as well as IUI pregnancies to happen. If these tubes are blocked, then IUI is no longer an option for you, right? So number one in IUI, your fallopian tubes have to be open, and the success rate that is there in the medical literature is 15 to 20% per cycle. That's what we see, okay? Coming to IVF, well, it's certainly more expensive. We are all aware of that. More drugs are used. It can have greater side effects. Of course, these days, these are managed very well. So again, this is not about IVF bashing, but you should be aware of what happens when you choose an IVF. Fallopian tubes don't have to be open. In fact, this is the number one indication for IVF. If your tubes are blocked, there is no place for the egg and the sperm to meet naturally. Therefore, IVF is literally your only option. There are some things which can help in some cases to open up fallopian tubes, but other than that, if the tubes are blocked, you will need to go in for an IVF. Now, this is a highly controversial topic. I'll be spending a couple of minutes on this. In our understanding, the success rate on average is 25 to 30% per cycle of IVF. So again, why do you choose IVF? Well, the number one reason, and actually the one with the most amount of proof, in fact, the first lady who was born through IVF, the first test tube baby who turned 42, I think this year, her mother had blocked fallopian tubes. And that was the reason why she opted for IVF. All of these other conditions, which, for which IVF is being routinely recommended these days, is often stuff where there is lesser amount of evidence that IVF has the same kind of success, or that it is indicated before you actually look at other options. So I'll show you why it is that, IVF does not seem to have as much success rate as we would expect. Now, what are these success rates? Well, IVF success rates really swing. How many cycles do you need? What is the implantation rate versus the live birth? Many clinics, claim one versus the other. Are you using your own eggs as a woman who is of advanced maternal age above 35, or is it donor? Now, all of these things can actually influence it. Now, the more conventional doctors, I've just picked up some samples from their website. So Dr. Pai claims around a 40% success rate for women under 37. And you can see as the age goes to the right, the success rate keeps coming down. When you look at CARE IVF, again, for a 30-year-old, 30% success rate, for a 35-year-old, 10%, and for a 40-year-old, 5% success rate. These, I would say, are the most conservative rates that, I have seen. Some of the guys who claim a lot more, see the discrepancy, right? So you've got IVF with self eggs sitting at around 65% over here. How can there be such a big swing? But yes, these are commercial claims that happen. And of course, one of the market leaders, Indira IVF, claims an over 75% success rate. Now, how is that possible? When you go in and look at the actual data, what Indira IVF is claiming is that once they do a embryo transfer, there is a particular test that is done, which is called a beta HCG test. And if the beta HCG test comes positive, then they claim that that is a success rate. Of course, no couple actually wants a beta HCG that is positive. They want this live baby. And what is the actual rate of number of live babies who are born in an average IVF cycle? So when we looked at the independent data, it's important to make sure that you study it in the right geography, meaning Indian genetics are different from others. So here you have it, a 2019 study analyzed data from 36,000 IVF cycles and the overall live birth rate. This is, of course, average per embryo transfer was 29.3%. And of course, when you speak to them privately, not on their marketing kind of material, most IVF specialists agree that this is a more realistic sounding average success rate. Okay. Why is it that, we've got so many people who now seem to be getting pushed into IVF? Well, I'm afraid there is a commercial interest here as well. There can be huge pressures which happen when there are private equity investments. In 2020, there were 2.5 lakh cycles per year done in India. It's expected to go up to around 5 to 6 lakh cycles. And the latest deal, you must have all read it in the papers, Indira IVF has been valued at 9,100 crores. So yes, there is indeed some amount of commercial reasons as why you might get pushed into IVF. To the heart of our question, why does IVF fail? If we are saying that on average, 2 out of 3 cycles of IVF do not lead to a live baby, why is it that this happens? Well, if there's one slide you need to take back and one slide that tells you how to think about IVF, it is this. No one really knows yet. Can you believe it? We have had millions of cycles of IVF happen, but human fertility is still a black box. Basic research on why an egg and a sperm actually create an embryo and what leads to success or failure is simply not known. Research spending on human embryos, which are purely for research, has been banned since 1996 in the US. This is literally because of worries around genetic engineering and things like that. And therefore, all that is currently being done is repeated cycles are done with some amounts of drugs that are changed by well-meaning doctors. Again, this is not about IVF bashing, but this is the state of the art itself. Just reproductive system drugs are changed, one gonadotropin versus the other, certain number of days versus another, and so on. And you're finally looking for either success happens or finally after, let's say, 7 or 8 cycles, on average, I would say they would finally say, doesn't seem like there is hope, at least with your own eggs. You may want to consider donor cycles and so on. Okay. Now, this is from Dr. Rita Vesena. She is somebody who's very senior in the fertility space. She sat on the boards of multiple of these IVF chains. And look at what she's saying. Because we don't have a clear understanding of how the normal physiology works when it comes to fertility, it is very hard for us to do something because we don't know if we change this receptor or that medicine, then this cascade will work differently. So by and large, we don't know. This is the truth even today about basic fertility knowledge, which may well be the reason why IVF can still have not, what would be considered by any patient as a high failure rate at 2 out of 3 cycles not really working out. What can functional medicine do about this? And this is where I love the medicine that we practice, the functional medicine. How can you look at fertility from a functional approach, right? So look at all this. So, whether it's poor egg quality, sperm damage, here is where the causes begin to come in, which your conventional doctors may not be really trained to look at or pay that much attention to. Yes, excess BMI is treated, especially in the woman, but many times we find that even a slightly overweight, so look at this, 25 BMI and plus can still have a negative impact on your fertility. Thyroid function is often ignored. Dr. Vivek Kadambi, our senior and somebody who helps us in our clinic with BHRT for poor thyroid function, we've seen case after case where this has been ignored. Vitamins and minerals, of course, are only given as a nice add-on, one multivitamin, one folic acid. That's pretty much all we see in prescriptions which are preparing people for IVF. And this very difficult and thing to fix, which is stress impact. All of this can make a difference. So conventional gynecology, we like to tell our patients, think of your health as a 5-story building. Reproduction is the top floor. This is what conventional gynecology works on. So they're working on sperm, they're working on eggs, they're giving you gonadotropins, letrozole, clomiphene, gonal F, extraction of egg, creation of embryos. All of this is happening in the reproductive floor. But there are 4 floors below it that actually impact the function of the 5th floor. So the functional approach is work on the foundational floors, work on your diet, on your macronutrients, which means the right balance of proteins, fats, and carbs. Work on your vitamins and minerals, D3, B12, iron, zinc, several cofactors, selenium, etc. Leads us to thyroid, the master energy gland. Many people come to us with fertility issues, having just done a TSH or a total T3 or total T4. Like Dr. Anjali Huda mentioned, always test free T3, free T4, TSH. Egg production, sperm production, creation of a new life is a very energy intensive process. So as you would expect, the thyroid gland, which is the master energy producer, has a huge role to play. Many cases of fixing thyroid hormones leads to the reproductive system responding beautifully. Stress and lifestyle, of course, if you're in a fight and flight situation, your body is not going to reproduce. This is not just general theory. This is what we find in the clinic. It can make a huge difference, and that is through the hypothalamus pituitary gonadal axis. If your brain feels that you are under a threat, it does not prioritize reproduction, does not stimulate the gonads don't get the energy they need. So there is a lot there. When you fix all of this through what we have chosen, well, this is Sepalika's approach. Other functional doctors use another combination of these various things. For us, nutrition is at the center of what we do, number one. Then, of course, like I said, dietary supplements. I would put lifestyle management at number 3, just by making you sleep better, drink more water, chew your food properly. There's just magic that can happen across your fertility as well. Of course, herbals, and like I said, T3, it can make a big difference to your fertility outcomes, both on ovulation for women, for sperm for men, and of course, the embryo and the final pregnancy and live birth. Magnet acutherapy is something that we do as a special thing. Again, in a functional medicine approach, we integrate multiple modalities, and the synergy between these makes a big difference to what really happens. Okay. So the way we explain it to all our patients is there are 5 factors within the reproductive system. There's your egg, your sperms, your fallopian tubes, uterus, and ovaries. In function, look at these 5 floors, and you can optimize these, and you can influence them. I'd request the organizer to kindly mute everybody else till we are okay. There's a lot of sound disturbance. Thank you so much. And of course, there are 5 petals that we have chosen to work with. It doesn't matter if other functional medicine doctors may change one or the other particular modality. But the idea is if you work on these 5 floors, and it usually takes us between 3 to 6 months, we have seen cases that actually change, right? So what I'm going to give you, we have very limited time, so I'm only going to give you quick summaries. So of the 33 pregnancies that we've seen in the last couple of years, you've got, first case I'm presenting to you, age is 36 years, trying to conceive for 12 years, 9 failed rounds of IVF. The tubes have to be open if you're going to try for natural or IUI. It was in this particular case. What was the one thing that this lady had as a problem? There were autoimmune thyroid antibodies that had not been detected. We detected it only because the TSH was slightly high. We put her on an anti-inflammatory diet. gave her the vitamins and minerals that she was lacking, used T3 to improve her thyroid function, gave her acupressure. She didn't need to lose too much weight, but she lost healthy weight. Well, she had a baby boy conceived in the 3rd month of treatment. What's more, not only has that baby boy, was he healthily delivered, we had the same lady go on to actually deliver a baby girl as a second baby with zero help from us. Once you fix the foundations, things begin to work by themselves. Second case quickly, age of 34, trying to conceive for 2 years, 2 failed rounds of IVF. She had low AMH, so she had been recommended that only IVF will work for her, but her tubes were open. And what was her problem? Well, she was not digesting her food well. She was not sleeping well. Every time she would sit, on a Zoom consult with us, you could see that she was in an extreme hurry. She was always stressed out. And what did we do? Calmed her down, helped her to chew her food better, helped her, with herbals. The functional changes that we noticed in the lower floors was bloating was gone, gasiness was gone. She slept better, saw the weight loss. It's an ongoing pregnancy right now. She's actually well advanced into her 2nd trimester. She conceived in the 9th month of treatment. Why did it take us 9 months? I said 3 to 6 months. Well, it was because she was in a tearing hurry. The more she was in a hurry, the lesser her body responded, until she didn't finally reduce her stress and did not get off the rocket. Nothing worked. Once she got off the rocket, well, things worked for her. All right, third case, 36, trying to conceive for 3 years. I'm just trying to pick very different cases, one from the other. This is a case of secondary infertility, where the first child had been born through IVF because she was told with low AMH, nothing else will work. They tried naturally, didn't work. So after the first child from IVF, she had had so many side effects during the entire stimulation and first IVF process. She wanted to try naturally. When that didn't work, she went for one more IVF round for a second child. Her one tube was even blocked. Only a second tube was open. We said, all right, we'll help you build your foundations. We'll help the lower floors. And then if it's meant to happen, it will happen. That's what we did. We detected that she had poor progesterone in the second half of her period cycle. Many don't know that this can be a sign of poor ovulation. When you measure serum progesterone 7 days before your next expected period date, it can tell you how are you doing and what is it that you need to do. So we improved her ovulation. With Dr. Vivek Kadambi's help, we gave her supplemental progesterone throughout her pregnancy. This is again not done in conventional gynecological practice, but we tested. She had had a severe issues in her first pregnancy. Therefore, the progesterone was indicated. Energy is improved, of course. Progesterone levels were better. She conceived her baby girl in the 4th month of treatment and delivered it, right? So these are just a few actual case summaries. So we've had 25 babies delivered functionally, right? We've got 8 more babies who are on the way, different trimesters. Is this a fluke? Because it's a very small sample size. We are a single clinic. So it's a right question. Is this a fluke or not? So my answer is always evidence-based medicine. Where is the research? Well, there is enough and more research. Look at the number one thing: eating a pro-fertility, anti-inflammatory diet, one that is, Mediterranean style. It doesn't mean in India you have to eat a Mediterranean style diet and, drop olive oil on everything. What is the core of the Mediterranean diet? Lots of fresh green vegetables, nuts, good fats. This is what you need to do. And you will find that when you have that kind of a diet, it impacts IVF success rates. I'm not even, so when I looked at the literature, obviously the literature is going to have much greater support for IVF because that's where all the data is actually gathered. So all the stuff that I'm showing you is, even if you need IVF, can your fixing your foundations help you get better rates? And there is published data. Of course, IFM eventually 2 days after this whole conference will be making live videos, etc. The recordings available to you. You're all welcome to go and check these studies. This is the actual evidence. Is there evidence for supplements and lifestyle? There is, absolutely. You sleep better, you get your yoga going, you work on your dietary supplements for things that are actually missing, D3, B12, K2, etc., you will find there is a risk. There is actually a difference. My time is running out, but I'm still going to finish just these important evidence parts. Is there published research for counseling? This is a huge area that everybody ignores. And yes, there is absolute evidence that psychotherapeutic counseling makes a big difference even before IVF rounds. The amount of stress that a couple goes through with infertility, with just repeated treatments, feeling completely disempowered, just getting injection after injection. Doctors aren't always trained to be the best, communicators, and IVF doctors especially are very busy. All this can make you very psychologically stressed, and that's not an ideal place to conceive. So yes, there is research. Counseling can make a difference. What about acupressure and massage? I mean, if anything sounds mumbo jumbo and voodoo, here it is. But there is so much published evidence for actually improvement of implantation rates, for improvements of IVF outcomes with acupressure and massage. So we always encourage our couples to ask, do I really need IVF? And again, for the last time, this is not to bash IVF. It's a miraculous treatment. But first ask yourself these questions. Am I eating a well-balanced diet? And this is a simple diet. Again, because time is very, we're trying to keep it to schedule. I would request that at the end of this, we'll give you an email address. Please write into us and we'll share PDF resources and all of this for all of the participants who are here and want to have more detailed information on this. But ask yourself, is my daily meal plate looking half veggies, 1/4 salad, 1/4 cooked vegetables? Is 1/4 of it good protein? Anything from paneer, dal, animal protein? Do we have only 1/4 as grain? Cook it all in healthy fats. Am I digesting, absorbing nutrition from my food and eliminating waste? If you have bloating, gasiness, constipation, or you're overweight, this is not the right place to conceive. Is my thyroid working well? Check free T3, thyroid antibodies and symptoms. Am I sleeping well? Am I feeling rested? Am I managing my stress well? Get 7 to 8 hours of uninterrupted sleep. You must be waking up, feeling fresh. First, answer a resounding yes to these 4 questions. Once you have done that, you can consider IVF. As long as all other things are ruled out, nothing else is working for you, IVF may well be the answer. But even IVF can do better if you fix these foundations. So that's my presentation. Thank you very much for your patient listening. That's the email address. I'm afraid for Monday morning tips, as Dr. Preeti Nanda likes to call it, if you write into us, we will give you written materials to help you to actually help fix your own foundations.
Thank you so much, Mahesh sir. Thank you so much for sharing your insights on IVF and, fixing the foundation of the body first and, talking about the 5 pillars and then moving to the 6th. Thanks a lot. There's though one question in the chat, but I'd like to ask you to you. What is magnet acupressure? Yeah.
So magnet acupressure is a modern day evolution of acupuncture and acupressure, in that you have very small magnets that you fix on to the acupuncture meridians overnight. And as you sleep for 8 to 10 hours, it balances the acupuncture meridians so that you can get better outcomes.
There's one more question as well. Your insights on egg freezing, at what age and prerequisites for the same?
Same prerequisites as for IVF. Please fix your foundations first. You're trying to get your eggs to be as healthy as possible. The eggs are formed from the food you eat and what you digest and what you absorb. So please make sure that you fix your foundations. The ideal age to try and get egg freezing done, I'll get brickbats for this, is before the age of 35. Don't try to freeze your eggs at 35 and say, I will conceive at 40. At least in the Indian population, we find that we don't get a very good egg harvest at age 35. So early 30s, at least, to freeze your eggs.
Okay. Thank you so much, sir, for your session. And we would like to move to the next speaker. Thank you so much for joining us.
Thank you, everybody.